We don't know the exact scale of inappropriate removals, but GPs I spoke to said the list cleaning process has been aggressive. One said 500 patients had been removed in total from their practice and that dozens had been reinstated after staff spent hours calling around. So, a really substantial proportion of removals in that case were in fact legitimate patients. Another said they'd reinstated something like 30 to 40% of patients flagged for removal. But they said it was inevitable that patients would be cut from their list inappropriately just because they hadn't managed to contact them in time. And what that means is that when patients who may not visit their GP very often do actually need care, they turn up and find they're no longer registered, and potentially then they end up heading to A&E. The BMA pointed out that a single visit to A&E costs far more than the amount GPs are paid to look after a patient for a whole year. So inappropriate removals are absolutely a false economy and can end up costing the NHS a lot more than it saves by taking someone off of a practice list. GPs pointed out too that general practice overall is underfunded. So if this whole process strips out more funding from the profession, particularly at a time when the government wants to move more work out of hospitals and into primary care, that's really damaging. So they're also calling for this money to be recycled back into the profession